Greetings for the day, dear learners. Welcome to SAU E-Learn, an online learning initiative of St. Joseph College for Women, Autonomous, Visakhapatnam. Myself, Dr. T. Gayatri, Assistant Professor, Department of Home Science, St. Joseph College for Women, Visakhapatnam, will be facilitator for your course, Health, Hygiene and Wellness. Today, we will be moving on to Part 2 of Management of Health and Wellness. In this section, you will learn about definition and concept of stress, anxiety, depression, and management of mental health. Stress. Stress can be defined as the body's response to any demand or challenge, whether it is physical, emotional, or psychological. It is a natural reaction triggered by an external or internal factors, often referred as stressors. Concept. Stress can be acute or chronic. Acute is short-term stress, chronic is long-term stress. Stress activates the body's fight or flight response, releasing hormones like cortisol and adrenaline, which are also known as stress-causing hormones. While mild stress can be beneficial for us, which is also known as eustress. Chronic stress can lead to health problems like hypertension, weakened immunity, and mental exhaustion. Symptoms of stress: irritability, that is increased irritation and changes in mood. Eating habits: overeating or undereating due to stress. Procrastination, that is avoiding responsibility and procrastinating difficult tasks. Nervous habits: engaging in nervous habits like nail biting and fidgeting with hair. Restlessness, inability to relax or feeling at rest. Increased use of stimulants, it can be anything like cigarette, caffeine or alcohol, which can lead to addiction. Concentration issues, that is difficulty in concentrating and frequent forgetfulness of trivial matters. Example of stressful situation can be a working mother balancing job deadlines and family responsibilities. I have given an example over here. Like Mrs. Priya, a marketing executive, has an important presentation at work while also managing her child's school project and household chores. She feels overwhelmed, experiences headaches, and finds it difficult to concentrate. Stress arises due to excessive demands, but it can be temporary and manageable with effective coping strategies like time management, planning, and forecasting. Next, let us move on to anxiety. Anxiety, it's a state of excessive worry, fear, or nervousness about future events or uncertainties. It is a normal response to stress but becomes a disorder when it is persistent and interferes with daily life. Concept: anxiety includes both cognitive thoughts and psychological responses. Common types of anxiety could be social anxiety, panic disorder towards any situation, phobias, that is fearfulness towards any particular situations or things, or GAD, that is generalized anxiety disorder. Unlike stress, anxiety often persists even in the absence of an immediate stressor. It is a continuous state of mind. Behavioral changes that we can see in anxiety. The following picture represents the behavioral changes that are anxiety related. For example, over preparedness, that is excessively preparing for tasks to mitigate or reduce anxiety. Social avoidance, avoiding social interactions and activities due to social anxiety. Reassurance seeking, constantly asking others for confirmation and support to feel good. Ritualistic behaviors, engaging in repetitive actions to alleviate anxiety. Sleep disturbances, experiencing difficulty in sleeping due to racing thoughts. Nervous energy, displaying physical signs of anxiety like tapping and shaking of feet. Decision making struggles, facing challenges in making choices due to fear. For better understanding, let us discuss some examples of anxiety. Here is a situation. A student preparing for a competitive exam. Ramesh, an engineering student, constantly worries about failing an entrance exam. Despite thorough preparation, he experiences excessive sweating, racing thoughts, and sleepless nights. Even after the exam, he keeps fearing a poor result. Anxiety is a persistent feeling of worry and fear, often beyond the actual situation. Anxiety generally occurs when we think about the result, then the current situation. Result in something, students, which that we don't have in our hand. So there is no point in stressing over the result. The only way to beat anxiety is giving your best at the present moment. Next is depression. Depression is a mood disorder characterized by persistent sadness, loss of interest in activities, and a range of cognitive and physical symptoms that affect daily functioning. Depression is more than sadness, it affects emotions, thoughts, and physical well being to an extended period of time. Professional support is often required for a person who is suffering from depression. Depression affects emotion, thoughts, and behavior. It can be caused by genetic, biochemical, environmental, and psychological disorders. Symptoms include fatigue, change in appetite, sleep disturbances, and feeling of hopelessness. Types of depression are major depressive disorder, that is MMD, persistent depressive disorder, dysthymia, and bipolar depression. Next is what kind of behavioral changes in sane in depression. From the figure, we have enlisted 8 kind of behavioral changes that is very common when a person is suffering from depression. Withdrawing from social interactions, neglecting personal hygiene, that is keeping very untidy, sleep pattern changes, decreases performance at work and home, loss of interest in any activity, slower reaction time, change in emotional responses. Example of depressive situation. A middle-aged man facing jobless and personal struggle. Mr. Arun, a 45-year-old banker, loses his job due to company downsizing. Over the time, he loses interest in social interaction, feels hopeless, has trouble sleeping, and experiences loss of appetite. Despite encouragement from his family, he feels unmotivated and detached from life. Depression is more than sadness. It affects emotional, thoughts, and physical well-being. Professional support is often required while treating depression. All these 3 different mental states, that is anxiety, stress, and depression, are interrelated to each other. Stress leads to anxiety, and prolonged anxiety can contribute to depression. Cortisol dysregulation from chronic stress often leads to depression according to many scientific studies. Next is management of mental health. There are many strategies to manage mental health. 4 of them are discussed over here. First is exercise. Regular physical activity releases endorphins, which are also known as happy hormones, which reduce stress and improve mood. Activities like walking, yoga, strength training, and dance help manage anxiety and depression. Exercise also improves sleep and boosts self-confidence and self-esteem. Mindfulness. Practicing mindfulness involves focus on the present moment without any judgment. Techniques include meditation, deep breathing, journaling, and mindful eating. That is, eating without any screen. Reduces stress, enhances emotional regulation, and improves focus. One of the best ways to practice mindfulness is not doing multitasking. Yes, you heard it right. Multitasking is not a very good practice for our mental health. Always complete one job and then move on to the other, which will keep your focus 100%. Next is social support. A strong support system, that is from family, friends, and community, provides emotional stability. Talking about feelings helps process emotions and reduce loneliness. Engaging in social activities fosters a sense of belonging and purpose. Last is therapy. Therapy is professional counseling or psychotherapy. Example, cognitive behavior therapy, talk therapy, etc. Therapy helps address mental health challenges. Therapist provides coping mechanism, behavioral strategies, and emotional support by providing a safe environment for the patient to speak. Therapy can be individual, it can be group based, or after COVID, everything has gone online, so therapies are also online. Thank you, learners.